From chemotherapy to radiation therapy to compassionate support, Arizona Oncology is the state's leader in cancer care. And just as important as cancer treatment is cancer prevention. And joining us to discuss is Dr. Sudhir Manda. Doctor, thank you so much for being here.
Thank you for inviting me.
Of course. So we're talking today specifically about colorectal cancer. For someone who may not know what that is, can you explain it to us?
Sure. It just means the cancer that involves either the colon or the rectum. It's combined as a colorectal cancer.
And how prevalent is it, I mean, among men and women and in terms of cancer deaths?
Well, colorectal cancer, the incidence has been going down over the years, but it's still around 150,000 patients are diagnosed with colorectal cancers. 2/3 of them are in colon and 1/3 in rectal cancers. And with time, the incidence of or the prevalence of death is still third leading cause of death in men, and a third leading cause of death in women with cancer-related deaths.
Well, it's certainly good news to hear that the cases are diminishing, however slight that may be. And as far as risk factors, if someone is either more at risk or less at risk of developing it, what are those?
Well, to answer that question, broadly, we have to divide the colorectal cancers into, is it something that was a hereditary cancer? So that means there's a mutation or a genetic condition that was passed on through the family. Obviously, those people are at higher risk than the rest of the population. And then we look at the sporadic population or the sporadic mutations that are not passed on through the families, but there are risk factors that contribute to that cancer. Some of the risk factors that we know are unhealthy, means less physical activity.
Sedentary lifestyle.
Sedentary lifestyle, that's a way to put it. Obesity, that's again from the sedentary lifestyles. Alcohol, and then there's also a lot of evidence that high red meat consumption or processed meat causes colon cancers or the rectal cancers, and probably that's why the incidence is more in the Western countries compared to African or Asian countries.
Right.
It's still debatable, but there's a lot more research going into that field.
Now, having said, you know, the lifestyle choices that may lead to a higher risk of getting it, how can it be prevented? I mean, if it's hereditary, for example, people might think it's a hopeless situation. If it's sporadic, it can certainly be prevented probably, but what would you tell people if they want to prevent this?
It's a great question. So if there is, so it all depends on the family history. If there is a history that of family members being diagnosed with colon or rectal cancers at a young age, then there are genetic screening tests that can detect or someone with a condition, a hereditary condition, and they have different screening processes or procedures that start at a much earlier age. For the rest of the population, or the average population, means at a risk from colon cancer, the screening starts at 50 years. But for high-risk people, we kind of start at a younger age. Interestingly, even though the incidence of colon and rectal cancers have been decreasing, we have also found that the incidence of rectal cancers predominantly, and some part of the colon cancers, has been increasing over the last 2 decades in people younger than 50. It's still a small subset, but it's going up, and some of the ideas behind that, or theories, is lifestyle and dietary habits at this point.
So screening is certainly an important way to prevent that. Lifestyle changes too, and say the unthinkable happens, someone is diagnosed with colorectal cancer. How is it treated from that point?
So it depends, just like a lot of things in life. It depends on the stage. Earlier stages, so the cancers are divided from stage 1 to stage 4. The stage 1 is a much earlier stage where surgery alone might suffice with a cure rates of more than 90%. And then as the staging goes up, the survival decreases. So that's why the emphasis is on trying to catch them early on. If someone is in a more advanced stage, like a stage 3, then it's a multimodality treatment, surgery, chemotherapy, and sometimes radiation if it's rectal cancers. So it needs a teamwork to take care of these.
A big takeaway here is it varies case by case, and you mentioned that teamwork, and that's where Arizona Oncology comes in. I want you to take a moment to tell us about the staff and the physicians there, because by all accounts, it's an amazing group of people.
Absolutely. So we what we do is look at what does the patient want, and based on their needs, and because even though someone wants the entire spectrum of treatments, which can be quite aggressive for some people, they want to focus on life or quality of life, then we kind of have a team that can figure out what are the needs of the particular patient, and we kind of go with their requirements. So that's from a clinical care point of view. How do we bring the best possible treatment options to the patients? We have a separate clinical team for that. And then there is to bring the research, we have a research team.
Yeah.
So we have the whole spectrum of oncology care at Arizona Oncology.
It's the complete solution. It's patient-centered care, and of course, with something as difficult and challenging as cancer, you want those compassionate people on your team and behind you. So, Doctor, thank you so much for coming on today, educating us, and thank you to everybody at Arizona Oncology for fighting the good fight.
Thank you. Thank you for inviting us.
Absolutely. Now, to learn more about the cutting-edge research and clinical trials taking place at Arizona Oncology, log on to ArizonaOncology.com or call 520-886-0206.